Welcome to Crisis in Perception, where we examine the systems shaping our world. I'm so glad you're joining us for this deep dive. Today, we are going to try to change the way you breathe, or at least fundamentally alter the way you think about the act of breathing.
Yeah, it's one of those topics that seems incredibly simple on the surface, right? We
Yeah.
do it, what, 12 to 20 times a minute?
Mm.
It's totally autonomic. You don't have to think about it to stay alive.
Right.
And yet, as we're going to see today, the air itself, and specifically our institutional understanding of it, is wrapped in these massive layers of history, military secrecy, and bureaucratic maneuvering.
It really is. And we are looking at a fantastic entry point for this today, a book called Airborne, The Hidden History of the Life We Breathe by Carl Zimmer. And look, I think for most of us, when you look across a room, you just see, well, nothing.
Just empty space.
Exactly. Unless it's a smoky room or a really foggy day outside, air is just space. It's the void between me and you.
Which is the first massive misperception. We tend to view air as this vacuum that just happens to have oxygen floating around in it. But the core premise we need to start with today, the lens for this entire systems-level analysis, is that air is not empty space. It is a gaseous ocean.
A gaseous ocean. I love that framing.
We live inside it exactly like fish live in water. It has currents, it has tides, turbulence, and most importantly for our discussion, it is absolutely teeming with life.
Teeming with life and death, frankly.
Yeah, and death. We inhale this fluid, it physically changes our bodies, and then we exhale it back out, altered.
Yeah.
It's a biological fluid that connects every single living thing on the planet.
And I feel like we have to address the elephant in the room right up front, or the virus in the room, I guess, because we've all just lived through this massive global trauma with COVID-19. And looking back at those early months in 2020, there was this agonizing period where the biggest public health disaster in a century was unfolding, and we were all obsessed with washing our groceries.
Oh, absolutely. We were scrubbing cereal boxes with bleach wipes, leaving Amazon packages in the garage for 3 days.
Right. And meanwhile, there was this fundamental mystery that the authorities, the public health bureaucracies, couldn't seem to solve. Is it in the air?
And that delay, that refusal to see the air, isn't just a simple mistake. It is the predictable outcome of a system.
Which is our mission for this deep dive.
Exactly. We aren't just doing a history of germs today. We are analyzing the institutional architecture. We're looking at the system that decided what counted as scientific fact regarding the air and how that specific design blinded us to reality.
How did we end up in a world where we diligently sanitized our mail while breathing in a virus?
To understand that, you have to look at the fragmented research silos, the biodefense funding, and the literal physics of turbulence.
So let's unpack the system's design, because before we had germ theory, before we even knew what a virus was, we had a totally different operating system for public health.
We did. For thousands of years, really, from Hippocrates all the way up to the mid-1800s, the dominant design for understanding disease was miasma.
Bad air.
Literally translated, yeah, bad air or pollution. The idea was that the atmosphere itself could become corrupted. It wasn't about a specific bug jumping from me to you. It was that the air in a certain place, maybe from a swamp or rotting corpses, had gone bad.
And it's so easy to mock that now as just medieval superstition, right? But if you put yourself in the shoes of someone in the 14th century, it actually makes a lot of intuitive sense.
It was incredibly logical based on sensory observation. You walk by a swamp, it smells terrible, people there get sick. Our noses are evolutionary warning systems for rotting organic matter, which usually contains pathogens.
Right. So miasma theory wasn't necessarily stupid. It was just...
Low resolution.
Yeah, low resolution. And it had real-world consequences for urban design. Like, the book mentions Pistoia, Italy.
Pistoia is a perfect example of this system in action. In 1296, the city council passed ordinances explicitly designed to fight miasma. They didn't have microscopes, but they banned anything that created a stench within the city walls.
So no tanning leather, no butchering animals in the street?
Exactly. No leaving piles of refuse. They believed that if you cleaned up the smell, you stopped the disease. And the fascinating thing is, it kind of worked.
Because by removing the rotting guts, you're removing the breeding ground for bacteria and rats, even if you don't know the microscopic reason why you're doing it.
It was the right action for the wrong reason. But the fatal flaw in the miasma design was its vagueness. It was a catch-all. It couldn't distinguish between malaria, which we now know as mosquitoes, and cholera, which is in the water. To miasma theory, it was all just the air.
It feels like a convenient excuse for a doctor back then. Like you can't cure a patient, so you just shrug and blame the east wind.
And that imprecision is exactly what led to the pivot. The pendulum swung hard in the late 19th century with Louis Pasteur and Robert Koch, the dawn of germ theory.
This is the moment we find the actual culprit. It's not a vague cloud anymore. It's a specific, tangible microbe.
Correct. This was a massive upgrade to the operating system. We moved from haunted air to physical bugs, but, and here's the crucial design flaw we need to focus on, in correcting the error of miasma, they created a brand new blind spot.
Because Pasteur actually did find germs in the air, didn't he?
He did. He caught them in flasks on the streets of Paris. He knew perfectly well they were airborne. But his most commercially successful work, the stuff that made him a national hero in France, was with silkworms.
Right. The silk industry was collapsing from some plague.
Yes, and Pasteur realized the disease killing the worms was spread by contact. It was the droppings on the leaves.
Yeah.
If a healthy worm crawled over a leaf where a sick worm had been, it got infected.
So this idea starts to form in the scientific community that germs are these heavy, sticky things.
Exactly. They fell in love with contact infection, the idea that disease is tangible. You touch a rail, you drink dirty water, you shake hands. It felt solid. It felt like real science, whereas miasma felt like ghost stories.
And this brings us to a character who really engineered the system we still live with today. Charles Chapin.
Charles Chapin is a fascinating figure. He was the superintendent of health in Providence, Rhode Island, around 1910. They called him the sanitarian.
And the Providence he was working in, this isn't a clean, modern city. This is the Industrial Revolution.
Total grime. Coal smoke, horse manure everywhere, crowded tenements, tuberculosis running rampant. Chapin is a pragmatist trying to save lives on a strict budget. And he looks at this lingering public belief in miasma, this idea that disease just floats around in the air, and he absolutely hates it.
Why? Just because it wasn't modern?
Because it made people passive. Think about the incentives. If the air is just universally bad, what can you as an individual do about it? Nothing. It's fatalistic.
You just sit there and hope you don't breathe.
Right. Chapin wanted a system based on human agency. He wanted to tell people, you are the source of disease. If you wash your hands, if you isolate the sick, if you stop spitting on the sidewalk, you can stop the spread.
He wanted to give people a job to do. Control.
He wanted to manufacture control. So he explicitly argued against airborne transmission because he felt it undermined that public agency. He wrote a hugely influential book called The Sources and Modes of Infection. It basically became the operating manual for public health.
And in it, he effectively labeled airborne transmission as a superstition.
He did. He said it was a relic of the Dark Ages. He effectively told the medical establishment, we are modern scientists, we don't believe in spooky vapors, we believe in contact.
So he designed a system where the word airborne was synonymous with unscientific.
Yes, and we have to be fair to him, it worked in the short term. Hygiene improved, infant mortality dropped. But the structural cost was massive. The system was now architecturally designed to reject the air as a vector.
If you claimed a disease was airborne in 1920, you sounded like a peasant scared of a swamp.
Precisely. You were laughed out of the room. So we entered the 20th century with this rigid dogma. Germs don't have wings, so they can't fly.
Which is such a powerful example of how an institutional narrative can blind you to reality. Which brings us to the second layer of our analysis. Incentives. Because physics doesn't care about Chapin's public health dogma.
Physics just is. And this is where we meet William Firth Wells and Mildred Wells.
The dissidents.
The dissidents. William Wells was a sanitary engineer at Harvard in the 1930s. He wasn't a medical doctor, which is crucial. He approached this entirely like an engineer. And along with his wife Mildred, who was a brilliant physician, they started looking at the actual fluid dynamics of a sneeze.
And they realized the droplet theory, this idea that all spit just arcs down and hits the ground, was structurally flawed.
Completely wrong.
Yeah.
The Chapin model assumed that when you sneeze, it's like a spray bottle. Big, heavy drops that fall to the floor within 3 to 6 feet.
Wait, the famous 6-foot rule, that's where this comes from.
That is the exact origin of the 6-foot rule. And for large drops, it's true, gravity works. But Wells applied physics. He realized that while big drops fall, small droplets have a massive surface area relative to their tiny volume. So they evaporate almost instantly. In a fraction of a second, the water is just gone.
So the droplet disappears.
The water disappears, but the passenger remains. What is left is a tiny dried-out husk of protein, salt, and virus.
The droplet nuclei.
Droplet nuclei. And these things are so small and light that gravity effectively loses its grip on them. They are ruled by drag and air currents. They float. They ride thermal plumes in a room exactly like smoke.
And Wells actually proved this, right? He built a machine.
He built a device called the air centrifuge. It was essentially a glass cylinder that he would spin at incredibly high speeds. He'd pump air from a room into this spinning tube, and the centrifugal force would fling the particles onto the agar-coated walls,
So he's physically catching these invisible husks.
catching the ghosts. He incubated the tubes, and colonies of bacteria grew. He went into textile mills, into hospitals, and caught germs floating in the upper air, near the ceiling, far away from any patient. He definitively proved the air was full of viable, floating bacteria.
Okay, so he has the proof. He has the physics. Why didn't the institutional system update? Why didn't public health say, wow, Chapin was wrong, we need to rethink this?
This is where you have to map the incentive architecture. Think about the infrastructure costs if Wells is right.
Right. If Wells is right, then standing 6 feet away is useless.
Exactly. The danger isn't just the person coughing next to you, it's the air in the room itself, the lobby, the classroom. To fix that, you can't just tell people to wash their hands. You have to literally rebuild the hospital. You need massive ventilation systems, HEPA filtration, structural redesign.
That is astronomically expensive.
The bureaucratic conservatism always resists massive capital expenditure. Public health is incentivized to find solutions that are cheap and behavioral. Wash your hands. Airborne theory demands a structural, systemic solution.
So the system is incentivized to protect the prior model. It chooses the cheap behavioral rule over the expensive structural reality.
Plus, there's risk aversion in public messaging. Telling people the air in the grocery store is dangerous creates panic you can't easily manage. Telling them to wipe down the counter gives them a task. It manages their anxiety.
But there was one institution that wasn't afraid of the air. In fact, they were pouring money into it. While public health was burying Wells's research, the military was weaponizing it.
This is where the story fractures. We move into the 1940s, World War II, and the Cold War. While civilian public health is shouting that diseases don't fly, the U.S. military is quietly spending millions proving that they absolutely do.
Camp Dietrich.
Camp Dietrich, Maryland, the War Research Service. The government engulfed the entire emerging field of aerobiology. They recruited these brilliant scientists, people who wanted to study life in the air to cure disease, and told them to study death from the air.
Zimmer talks about Theodore Rosebery here.
Rosebery is a very tragic figure, a brilliant microbiologist who wanted to save lives. But the institutional framing was, we need to build these biological weapons before the Axis powers do. So they built massive testing facilities, the cloud chamber, the 8-ball, this massive million-liter steel sphere where they could release aerosols and expose animals.
They were studying exactly how to keep a germ alive in a droplet nucleus so it could float over a city.
They mastered it. They learned how humidity and sunlight affected survival rates. And they didn't just test it in labs. They tested it in the real world.
This part of the book is staggering, the New York City subway experiment.
It sounds like a conspiracy theory, but it's documented history. In the 1960s, Army researchers carried light bulbs filled with a harmless bacteria that mimics anthrax onto the subway.
And they just smashed them.
Drop them right on the tracks. The trains rushed by, creating the piston effect, churning the air. And they had teams stationed at stations all over Manhattan testing the air.
And they found it everywhere, right?
Miles away. Within minutes, the entire subway grid was inoculated. They proved conclusively that a single aerosol release could contaminate an entire urban system.
So you have this massive epistemic gap. The military has classified data proving germs float for miles. Public health has public guidelines insisting germs fall to the ground in 6 feet.
And secrecy was the barrier. That classified status created an epistemic wall between institutions. The military's incentive was national security, which demands secrecy. Public health's incentive was social order, which demands simple, manageable rules.
So biodefense became this world of clouds and aerosols, while public health stayed in this silo of sneezes and hand washing.
They completely stopped talking to each other. The clinicians weren't reading the physics journals.
Which leads us perfectly into the outcomes, because eventually the physical reality of the world has to crash into that institutional denial. You can't hide physics forever.
You can't. And they tried to prove it to the medical establishment. We have to talk about the Lock-Raven experiment.
The infection machine. Set the scene for us. This is the late 1950s.
1957. Richard Riley, who was Wells's protege, finally gets the funding to run the ultimate natural experiment. He takes over a wing of a VA hospital in Baltimore called Lock-Raven.
And he turns the entire building into an instrument.
He really does. He sets up a tuberculosis ward with real patients on one floor. But he drastically alters the ventilation system. He seals the ducts and pumps the exhaust air from the patients' rooms straight up through the ceiling.
Into a penthouse on the roof, full of guinea pigs.
Hundreds of guinea pigs in cages.
So just to be clear, the guinea pigs are on the roof, The patients are below. They never touch. The nurses aren't tracking germs up the stairs.
Total physical separation. The only connection is the air moving through a metal duct. Riley ran this for 2 years.
And the outcome?
Dozens of guinea pigs got tuberculosis. The pattern of infection perfectly matched the mathematical modeling of the airflow. It was absolute, undeniable proof of airborne transmission. No contact. No heavy droplets falling on a floor.
So surely this is the paradigm shift. 1957. The system looks at this and says, okay, we were wrong.
You would think. But this is where the persistence of the system is so powerful. Instead of admitting that respiratory viruses generally are airborne, the medical bureaucracy created a special case.
They quarantined the truth.
Exactly. They said, okay, fine, TB is airborne, but TB is unique. It's this weird, hardy bacteria. Everything else, measles, flu, the chemical, those are still droplets.
They did mental gymnastics to protect the prior model?
Yes. They allowed airborne to exist, but only in a tiny, heavily restricted box. And to enforce this boundary, they invented a bureaucratic rule. The 5-micron dogma.
Right, this number pops up everywhere. 5 microns. What is the significance of that?
Alexander Langmuir, the chief epidemiologist at the CDC at the time, really championed this. He was a strict disciple of the contact school. He helped establish this rigid rule. If a particle is larger than 5 microns, it falls. If it's smaller, it floats.
But is that physically accurate?
No. It violates basic fluid dynamics, Stokes' law. That 10 or 20 micron particle can easily float across a room if there are air currents from a ventilation system.
It's like saying a feather drops straight down. Sure, in a vacuum. But in a room with an HVAC system, that feather is flying everywhere.
Exactly. But 5 microns became law. It was written into hospital design codes. It simplified everything. If you believe the 5-micron rule, you just need a surgical mask and a plastic curtain. If you deny it, you have to buy expensive negative pressure rooms.
And the consequence of this was the sick building syndrome in the 70s.
And the energy crisis hit, and we started building tight buildings. We sealed the windows. We recirculated the air to save on heating and cooling costs. And because the institutional standards assumed air wasn't a vector, the HVAC systems weren't designed to filter out pathogens.
They were designed for temperature, not infection control.
Right. So you get Legionnaire's disease, you get mold, you get measles outbreaks in schools where kids never touched each other. And the system just kept blaming individual behavior instead of the structural airflow.
Which brings us to the modern crisis, the persistence of this failure. Because this exact architecture of denial was still fully operational in 2020.
It was. When SARS-CoV-2 hit, the system worked exactly as it was designed to work. It failed to see the air.
Zimmer talks about Lydia Maraska and Junji Kao trying to sound the alarm in February 2020.
Maraska is a giant in aerosol physics. She looked at the data from the early cruise ship outbreaks and immediately knew it was airborne. She tried to publish warnings, medical journals rejected them, WHO ignored her.
Because she was a physicist, not an epidemiologist. Professional boundary maintenance.
Exactly. Silos.
Yeah.
And then we had the Skagit Valley Corral outbreak, the perfect, tragic, natural experiment.
Walk us through Skagit Valley, because this is where the surface interpretation completely falls apart.
March 2020, Washington State. A choir practice with 61 people. And they were being incredibly responsible by the standards of the day. They used hand sanitizer. They didn't hug. They stayed 6 feet apart.
They followed Chapin's rules perfectly.
Perfectly. But they sang for 2.5 hours in a room with poor ventilation. There was one index case, one person who didn't know they were infected.
And what happened?
52 out of the 61 people got infected. 2 died. There is zero mathematical way to explain an 87% attack rate with heavy droplets falling in a 6-foot radius. The virus filled the room like cigarette smoke. If that person had been smoking, everyone would have smelled it. Instead, they breathed it.
Yeah, right around that same time, you have that infamous WHO press conference.
The visual is just stunning in hindsight. The WHO experts sitting shoulder to shoulder in Geneva, no masks, explicitly denying airborne transmission on global television.
Why? With people dying, why the risk aversion in public messaging? Why not just say, we're not sure, better upgrade your masks just in case?
Path dependence. The leadership was entirely trained in the Langmuir droplet tradition. They didn't have fluid dynamicists at the table. And we have to talk about Lydia Borweaver's research here.
The MIT scientist with the high-speed cameras?
Yes. She showed that a sneeze isn't a spray of bullets. It's a turbulent gas cloud, a warm, moist cloud that traps droplets and carries them across a room, preventing them from evaporating or falling. The medical definition of a droplet fundamentally contradicted the physics of reality.
But there was also a huge logistical incentive to deny it, right? The global supply chain.
Huge. If the WHO declared it airborne, every hospital on Earth would instantly require N95 respirators and negative pressure rooms. We had a massive global shortage. The system, consciously or not, chose the scientific paradigm that matched their available inventory.
We tailored the science to fit the supply chain. That is a devastating institutional failure. We told people to wash their hands while they breathed in the virus.
We governed a biological reality with a logistical constraint.
It makes you look at every air vent in your office differently. But Zimmer doesn't end the book in total despair. There's this final phase of interconnection, zooming out from human disease.
Right, because if we stop viewing the air purely as a threat vector, as miasma, we find this incredible ecological system, the aerobiome.
The aerobiome. It sounds like science fiction.
It's the habitat of the sky. Zimmer introduces Fred Meyer from the 1930s. He had this wild project called the Sky Hook.
He was mounting sticky slides onto airplanes, right? Including Charles Lindbergh's plane.
Yes. Flying them into the stratosphere to see what was up there. And he found life. Mold spores, pollen, bacteria, miles above the Earth. A literal river of life flowing over our heads.
And the ballooning spiders. I think this is my favorite detail in the whole book.
It's amazing. Spiders that climb to the top of a blade of grass, shoot out a strand of silk, and use the Earth's electric field electrostatic repulsion to launch themselves into the upper atmosphere. They've been found miles high, crossing entire oceans.
They're surfing the electric sky.
They are, and it connects to weather systems, too.
Yeah.
Bacteria like Pseudomonas syringae act as ice nucleators. They float up from plants, their surface proteins organize water vapor into ice, and they literally create rain and snow.
So the bacteria are making the weather.
And riding the snowflakes back down. The biosphere and the atmosphere completely interlock. Zimmer also talks about Sahara dust. The Amazon rainforest runs on phosphorus carried by dust storms from the Sahara all the way across the Atlantic.
So by obsessing over droplets and 6-foot rules, we completely missed the majesty and the reality of this vast interconnected system.
Exactly. It's the One Health concept. You cannot separate human health from the physics of the atmosphere or the ecology of the planet.
So bringing this all together, we've mapped the design, the incentives, the systemic failures. I have to ask you directly, what is the crisis in perception here?
The core misperception is that we perceive air as inert, empty space. We think if we stay 6 feet apart, the nothingness protects us. But the reality is that air is a biological fluid. It's thick, it's turbulent, and it's shared.
And the structural layer is completely obscured.
Yes. We focus entirely on surface interpretation individual behavior, like hand washing or wearing a loose surgical mask, because it satisfies our psychological need for control. Meanwhile, the institutional incentives blind us to the structural airflow systems.
We tried to govern a physical biological system with a sociological tool.
Exactly. The institutions were designed to filter out miasma superstition, but they accidentally filtered out aerosol physics. They chose a comfortable, cheap dogma over a complex, expensive reality. Until we adopt a systems-level analysis, until we perceive the air as a shared infrastructure that requires structural mitigation, like ventilation and filtration, we will remain fundamentally vulnerable.
Crisis in perception examines how systems shape belief and how better tools help us see clearly.
Absolutely.
This project is free and publicly accessible. If you'd like to support the time, tools, and research behind Crisis in Perception, you can become a supporter on Patreon.
We really appreciate it.
For a shorter visual overview of this topic, see the mini explainer linked in the description.
It's a great summary.
If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.